Now granted, this is not an all-inclusive list, but it's going to kind of steer you in that right direction. Chapter 15, you need to know the different types of shock and an example of each, meaning the distributive, the obstructive, you feel me? Cardiogenic, hypovolemic, okay? And you need to be able to differentiate those. And then also know the different stages of shock, which is compensatory, decompensatory, and irreversible.
So if I just improve on these, that would kind of count. I think that would include most of what you're looking for.
Yeah, because if you look on,
Yeah, stage of the shock one, compensated, decompensated, reversible. It doesn't list like the types. You have to include that, the examples of them.
so 449's got a great table, and then the rest of the different ones that you could put in a table is on page 450 and 451. So here's the key to understanding the different types of shock, is if you understand the patho behind it, then the examples will automatically come to mind. Cardiogenic, okay, think cardiac, that's heart muscle, anything having to do with the heart muscle. So we're talking about an AMI, pericardial tamponade, anything about the heart that, okay. So hypovolemia, we talked about that. It's either the fact that you're either losing blood, fluid, or there's an interstitial fluid shift, okay? So again, if you'll kind of understand the patho behind them, then you'll understand the examples, okay? Don't get confused by examples of different shocks, because again, I don't want necessarily for you to tell me, okay, what are the 4 different types of shock, and you tell me anaphylactic shock is one of the major 4. It is not. It's one of the, it's a subcategory of distributive. Okay, so again, if you understand the patho, you'll be fine. Okay? All right? Chapter 16. Okay. He's got a great table. I think I gave y'all the table about chronic bronchitis, asthma, emphysema. Okay, so note those. I don't think. Okay, no hyperventilation syndrome. No hyperventilation syndrome. Some of the signs and symptoms, what you should be looking for, and then what is your treatment, okay? Remember, sometimes, a lot of times when someone goes through a hyperventilation syndrome, it's because it's due to something. Like they just heard bad news that, you know, a spouse or a loved one passed away, and then now they're in hysterics, or it's an emotional type of thing. So part of our treatment will want to, one, is to kind of pull them out of the environment and see if you can't get with them kind of one-on-one and kind of talk them down. If not, and they refuse and they just hyperventilating, okay, just time it. They'll pass out, okay? It's great. Just make sure you're there to catch them, or at least sit them down somewhere, okay? That's great. Sometimes it happens. They're not gonna think logically or reasonably, if you will. They're not gonna be able to follow your commands sometimes because they're just in that hyper-excited emotional state. So if necessary, okay, ma'am, just sit down, I understand, just sit down and just monitor them, because it's only a matter of time before they pass out, okay? When they pass out, that's great because the body just kind of resets itself. Body has a great thing to do. All right. Obviously, you need to know, and from the respiratory chapter, that you need to know all of the different parts of the respiratory system, just like you should know the cardiovascular system.
Is it 17 right?
No, I'm still on 16.
Cardiovascular.
Okay, so ensure that you know albuterol, one of your drugs that you should know. I gave you all your cards back today. Great job, by the way. Great job on your cards. Know anything and everything there is to know about albuterol when it comes to respiratory emergencies. Here, let me throw this out there. Chapter 17, know a drop of blood through the heart. I cannot stress that enough. Okay, so know the difference between angina, unstable angina, and an acute myocardial infarction. Okay? Angina and unstable angina and acute myocardial infarction, the signs and symptoms. What separates one from another? What kind of self-resolves itself with the patient's own medications versus one that does not? You feel where I'm going with that? Okay. No right-sided versus left-sided heart failure. Obviously, you need to be very familiar with nitro and aspirin. Chapter 18, altered mental status and stroke. Know what a stroke looks like and what FAST stands for. And know the difference between a stroke and a TIA. Okay, seizures, chapter 19. Know the different stages, or the stages of seizures, and know the different classification of seizures. Pay close attention to febrile seizures in children. And then pay close attention, read the paragraphs on post-ictal state. Okay, the post-ictal state is where the body's trying to kind of recover from the seizure activity. So read that paragraph and understand. Normally it takes up to 30 minutes to an hour for them to recover. We want to know how long their recovery is because, again, if it becomes longer and longer, they're more prone to have another seizure, okay? And anytime you have a patient who presents with a seizure, be expecting another one, okay? Be on the lookout. Be prepared to have another one, okay? All right, so, okay, so let me kind of clarify. The classifications of seizures, okay, here we go. the tonic clonic, okay, that's a full